We only have channel 8 and channel 6. We don't have channel 4.
I'm not, is that it? I'm not sure.
No, that's 9.
Yeah, enough.
Yes.
Let's do the last name. How do you say it? Ready? Good afternoon, everyone. Welcome to the University Medical Center, home of the Reverend Avery C. Alexander Academic Research Hospital. It's my honor to welcome all of you here today. I think this is a celebratory event for all of us. Let me thank the Governor Edwards for being here. We have the Secretary of Health, Dr. Rebecca Gee. I want to thank our mayor for being here. We also have Representative Joseph Bowie and John Bagnaris. Thank you for being here, and let me also thank our patients that we may talk about today a bit for being here, and also thank our physicians and the frontline staff that work in this beautiful institution every single day, caring for our patients and helping our great faculty from LSU and Tulane train the next generation of healthcare professionals. We're standing in a state-of-the-art $1.2 billion facility, but I would tell you it's not a facility without its people. And we have great people here. We're associated with great universities and faculty and frontline staff that are helping us care for our patients. You know, we're proud to be part of a public-private partnership with the state. LCMC Health formed our partnership several years ago, and we helped open the University Medical Center with the support of the state and our universities. And it's been a complete success. We're seeing our volumes grow in double digits. As you walk around the facility, I think you'll feel a very vibrant facility that's here for all patients. And I want to thank our CEO of UMC, Mr. Bill Masterton, for helping us make that a reality. This is really a humbling day when you think about what the governor did a year ago today by signing that executive order to put in place Medicaid expansion. It's humbling to think of the people that it helped. I think you'll all be humbled today to hear about some of those individuals. And the first one you'll hear about hear from is Phyllis. Phyllis, I'd like for you to say a few words.
Okay. Hello, everyone. My name is Phyllis, and I was diagnosed with ovarian cancer. And I had it for a while, but I didn't know it until the tumor burst. And if it wasn't for the Medicaid card, I don't know where I would be today, because I was told just a CAT scan is $2,000. And when she told me that, you know, I got kind of nervous. But I did have my medical card. And with the medical card, you know, it helped a lot. It really helped me. But like I said, I was diagnosed in July, and November the 21st, it was removed. And I would thank God for that.
Hello, everybody. It's an honor, a pleasure to be here with the governor, the mayor, and thank God for everything. And we've seen a lot of help from the Medicaid, from the hospital. I was the type of guy never seen a doctor, never had a cold, never been sick. I was renewing my children's Medicaid, and the lady asked me, like 2 weeks before I got sick, found out I had cancer, And she asked me, well, what about the rest of the family? What, need Medicaid? Need help? I said, well, if I could get it, I'll be honored to have it. So thanks to the governor, we got approved, got the Medicaid. I had some stomach problems. So I said, well, since I got insurance now, I could go see a doctor. So I went and seen the doctor, and they diagnosed me with colon cancer, liver cancer, lung cancer, and lymph node cancer in the lymph nodes. But thank God I'm doing a lot better, and thanks to the governor, mayor, that we got Medicaid, we got good health insurance in the state of Louisiana, and I thank God for everything. Thank you.
Hello, my name is Monica, and last year I was just a full-time student with 2 part-time jobs. I had been experiencing headaches for a while, which I thought were just the cause of stress from balancing school and work. And on October 18th, I was admitted to this hospital because of what I thought was a really bad migraine, and ended up being a glioblastoma, a cancer tumor on the right side of my brain. I did not have health insurance at the time, so it was really scary and overwhelming because I didn't know what to expect. And that was when, a night before the surgery, a social worker approached me and she told me about Medicaid expansion, and we applied for it. And thank God, 2 days after the surgery, I was told it was approved. And because it backtracks, it was a blessing because it not only covered the chemo and radiation treatment that I'm going through right now, but it also covered the surgery that I had gone already. So we're really grateful for this, for the opportunity about talking about a program that is impacting so many people in the country. Thank you.
Phyllis and Ricky and Monica, I want to thank you for coming to tell your stories. The reason that's important is quite often in government speak, when we talk about new programs and we talk about spending and investments, we talk in terms of numbers. And those numbers are huge, and they're not very personal, and you don't realize the real impact that they have on our brothers and sisters right here in Louisiana. And so by coming forward and telling your stories, hopefully people around our state will gain a fuller appreciation of how important this Medicaid expansion is. So thank you so much for being here. I also want to thank Senator J.P. Morrell and Senator Troy Carter, who joined us as well, and I know they weren't recognized earlier. Greg told you about Medicaid expansion and the executive order a year ago. I told a group that was gathered just a few moments ago, that is the easiest big decision that I will ever make as governor. And these individuals who just shared their stories with you, and many, many more across the state, have validated that decision. And it goes along with a lot more information that I am going to share with you now. During my time in the legislature, I watched how Medicaid expansion had worked in other states that adopted the expansion earlier than we did. I saw how our tax dollars are being spent in other states rather than coming back and being put to work for our people. I knew that 1 in 5 adults in Louisiana didn't have health insurance. And I also knew that Louisianans suffered some of the worst health outcomes in the country. All of this was intolerable. Most importantly, I had talked to too many people across our state who didn't make enough money so that they could afford insurance on their own. Their employers didn't offer it, but yet they made too much for Medicaid. So they were caught in a gap through absolutely no fault of their own. These good, decent, hardworking Louisianans were deprived of health insurance. Maybe they're a single mom like Krista raising 3 kids, 2 of which have a disability. Krista's here with us today as well. Or Julie, who desperately needed health insurance to manage her Crohn's disease so that she could take care of her child who also has special needs and continue to work while she does that. There are so many more stories like this. Among the 378,564 working Louisianans who have health insurance today that did not have it before. The vast majority of these individuals have health insurance for the first time since becoming an adult. And since we've enrolled these individuals into Medicaid expansion, just over the last 6 months, over 50,000 adults have received preventative care or new patient services. Nearly 5,000 women have been screened for breast cancer, 63 of which sadly received a cancer diagnosis, but they were able to get treatment for a disease that will kill them, except for the fact that now we know they have it and they're going to get treatment. 1,216 individuals have had polyps removed, avoiding cancer. Now that is life-saving. You just heard Ricky told you he developed colon cancer before he ever had health insurance. He didn't have access to the diagnostic evaluations, the colonoscopy that would have revealed those cancerous polyps so that they could be removed, hopefully while they were precancerous. By the way, this hits a little close to home for me because your governor just turned 50. And 2 weeks ago, I had my first colonoscopy. There were 6 polyps, all removed, 3 of which were precancerous. Those types of treatments and evaluations shouldn't just be available to the governor or to people who have means. They should be available to all of the people of Louisiana. Over 900 adults have been diagnosed and are now being treated for diabetes. 2,200 being treated for hypertension. And when you diagnose and start treatment of these diseases earlier, you're much more effective in that treatment. The people can have a higher quality of life, continue to work, and you actually spend less money than if you let those diseases progress too far before treatment starts. So behind every one of these numbers is a real live person, an individual just like the ones that you heard from. What's more, and this is important, it's not as important as what we just went through. Medicaid expansion is also saving state general fund dollars here in Louisiana. In the first year alone, through expansion, we're saving $184 million state general fund. That is almost 10% of that historic, unprecedented $2 billion budget deficit that I inherited. Over 200 new jobs have been directly created by expansion. The healthcare industry in Louisiana had record employment in October. We need that right now. And the financial soundness of our medical providers is more sound because they are distributing less unreimbursed care. All of this is about putting Louisiana first. It's what I said I would do when I ran for governor. It's what we're going to do every single day, just bringing our tax dollars home, putting work for our people here so that we can all enjoy a higher quality of life. And I told Dr. Gee and others, Medicaid expansion, if it saved us money, if it increased the folks who were insured and all that would all be great. But if it didn't deliver better health outcomes, it would not be a success. Well, it already is delivering better health outcomes, and those are measurable. And they are benefiting the people of Louisiana. So, Dr. Gee, thank you so much for your hard work. All of the people who are partnering with us around the state to provide these services that are saving lives every day. I also want to thank the Mayor of New Orleans for being here with us today, and I want to call on the Mayor to offer some comments. Thank you so much. God bless you.
Governor, thank you so much, and it's really wonderful to be with all of you today, particularly with the patients, to our senators and our state representatives, to all the leaders of this institution, and all the individuals that work here. I'm talking about from the bottom all the way to the top and across. Governor, I want to say to you, and I know that all of you know this, leadership really matters. The one thing that was standing in between whether or not Louisianians would put first and had access to affordable health care was the governor. And he promised during his campaign and in conversations that he had with the federal government, the Federal Department of Health and Human Services, the president, was that we share the theory, the philosophy, and the practical application that health care is a right. It is something that is about life and death. If you don't have access to affordable health care and you can't get early detection for whatever it is that you have, if you can't get preventative care, then you are going to get something that's going to make you sick faster. The chances of your having a successful outcome are less rather than more, and then people just can't be healthy. And if a state is going to compete, its people have to be strong. All of us depend on how each and every one of us individually is doing. And so when the governor did this as his first act in office, he exhibited a great amount of courage. From my perspective, historically, it was really a no-brainer. The people of Louisiana were basically financing health care for people in other states, and we weren't getting our fair share, and our citizens weren't having access to what it is that they needed. And each one of these individuals here today personified the impact of it, but there are 400,000 other individuals in the state of Louisiana that are just like these folks up here, that because they now have access to quality, affordable health care, they have a much better chance of having a great quality of life and a longer life than they would have, and Louisiana is the better for it. But as the governor said, this has wide-ranging ramifications. It's one of the reasons why 88 primary health care clinics currently exist in the metropolitan area where 300,000 folks can go. In the Mary Buck Health Clinic, as we speak, 300 women a month get mammograms that they were not able to get before. This particular hospital that you see standing, Children's Hospital, the New Orleans East Hospital, the Feist-Weiler Cancer Center, Pennington, by all of them benefit from having the resources necessary to pay the health care providers who are around this room, who are life-saving agents, and all of us together make Louisiana healthier because we have access to affordable health care. And there's a national conversation going on right now about repealing the opportunities for this. And if they did that, the consequences would be fairly dramatic. You can't just say, I'm going to take it away without someone to replace it with. And there are lots of Americans that are waiting, hanging in the balance to make sure that whatever Congress decides to do, they make sure that the individuals have access to health care, make sure that they're protected by not being excluded because of pre-existing conditions, make sure that they have the ability to stay on their parents' health care until they're 26, make sure that when they compete in an open market, they can actually afford all of those things and stay in place. But the premier place is the expansion of Medicaid. And that happened really because the governor of this state, this gentleman standing to the left of me, honored a campaign promise and a commitment he made to the people of the city, the people of the state, and of course to the people of the nation as well, and we're all the better for it. So, Governor, I thank you for that. And I'll let you know the price of all of this is vigilance. And we have to stand up and be counted, talk about what's necessary, but just talk about it from a very human perspective. And for the working men and women of Louisiana, this is one of the most important decisions that will be made in our political lifetime. So I'm happy to be here to support that effort, Governor. I'm happy to be here to support you and thank you for that courageous decision. So God bless you all, and thank you so much.
I'll be brief, but as Secretary of Health and as a practicing physician, I'll tell you that nothing is more important than health. And as a daughter of a woman who died of breast cancer, I'll tell you that every mammogram matters, and that no one should die of a cancer that's undiagnosed because of lack of care. Okay? So, I'm going to wait. So, the docs, and you'll see some of them in action right now because we're going to make sure everything's okay. Yeah. Okay. She's having a seizure. Yeah. Peter, do you want- Again, the only thing that hasn't been said is to thank the physicians and nurses and all the folks at this hospital and FQHCs and clinics throughout the state who are caring for the individuals in this state, because nothing is more important than our health. And it's a blessing to have Medicaid expansion. Almost 400,000 people, 50,000 of whom have not just had a card but gotten access to care. And our goal for the future is to make sure that every individual in the state has their cancer prevented, is as healthy as possible. And health is a human right that we all value. And thank you to the governor for your leadership. And it's a very exciting day, and we hope that that everything turns out okay. So I think we're going to ask questions.
Okay. At this point, we'll take some questions, but before we do that, I just ask you to quietly say a prayer for Phyllis, that she's going to be okay, and that they're going to render the effective treatment for her right now, as well as all of the other individuals who need care today. Okay, and if there are some questions, yes, sir. I knew you'd ask a question. Yeah. Well, it's if all they do is repeal and get around to the replacement later or never, if that repeal is effective immediately without anything in its place, then obviously health insurance for these individuals and all 378,000, I think it is, that have it as of today, would be taken away. I don't think that's a realistic thing for Congress to do. I don't believe that's going to happen. And in fact, when you hear about problems with the Affordable Care Act, almost never do the discussions involve Medicaid expansion. They involve things that happen on the exchanges and some changes that might ought to be made to make sure that people can see the doctor of their choice, or their premiums don't increase too much, and that sort of thing. So I hope that they will quickly come to realize what we now know in Louisiana. Medicaid expansion works. It benefits people. It improves lives. It saves lives. And I'm willing to work with the Trump administration, with the new Secretary of Health and Human Services, with our congressional delegation, to make sure that we protect what we have in Louisiana, because it is working in ways that I never imagined. It has been a success beyond my wildest dreams, and we need to keep it here in Louisiana, keep it available for these individuals.
Can you speak to your confidence level at this point as to some sort of revision that will include some sort of adequate replacement?
Well, the confidence level will come once we have information coming from Washington. They're in control of this issue. And all I can do is provide them the information as to how beneficial it has been to the state, for our people, for our finances, for our health care providers, for people who need employment, on every level. It's been a success. The confidence will come when we start hearing positive things back from Washington, that they understand, and that if the replacement involves Medicaid expansion, that there is going to be some reasonable facsimile of what we currently have. What I'm not interested in is being given more flexibility to spend fewer dollars so that I decide who loses health care coverage. That's not exciting to me.
How does the state plan to grappling with budget issues still? How do we plan to not cut healthcare, education, things like that as we continue to work through those?
Well, the Medicaid expansion component saved the state $184 million this year. Those dollars stabilized our budget to a very large degree. That accounted for 10% of the historic, unprecedented $2 billion budget deficit that I inherited. The Medicaid expansion is going to continue to save the state of Louisiana money going forward. So if we want to damage our fiscal situation even further, have it erode, one of the quickest ways to do that is to lose the Medicaid expansion. But we are going to be working with the legislative leadership. I met with the Speaker and the President today, that even as we take care of our current mid-year deficit, which will be recognized tomorrow in Baton Rouge, somewhere around $340 million, that we do it in a way that protects to the utmost that we can access to health care.
Have you met with Senators Cassidy and Kennedy and shared some of these numbers?
Yes, I have. And in fact, the numbers are available to everybody. They're on the dashboard. But we have specifically met with Senator Cassidy, and we sent a letter recently to Majority Leader McCarthy about Medicaid expansion and what the impact has been in Louisiana, and we shared that letter with every member of the congressional delegation, not just the senators.
Governor, sort of a follow-up to the previous question. Does the uncertainty in Washington now lead you to make any decisions regarding the state budget, acknowledging lawmakers will also have a say in it as well?
Yeah, no, the uncertainty itself isn't going to lead us to make any contrary decisions. We have it until we don't have it, and I hope we will continue to keep Medicaid expansion because it has been so positive for our state. But the uncertainty isn't going to cause us to change direction, but the uncertainty is an issue. And the sooner there can be clarity on this, I think the better off we're all going to be. I want to thank all of you for coming out today. Today truly is a celebration of something that's positive and impactful in Louisiana for thousands and thousands of fellow Louisianans, our fellow brothers and sisters. And so you're being here to mark this milestone. I really appreciate that. And we're going to continue to work every day in Louisiana to put Louisiana first. God bless you and thank you.